I know you've done a lot of work on masks and how effective masks are. Our children are back in school. I knew this would happen as soon as they had that 3 or 4 weeks before Easter. Our children are back in school once again, wearing masks all day, every day in secondary school. Is there any evidence that those face masks are what are keeping children or their teachers safe?
No, there isn't. There isn't at this moment in time evidence that masks in schools reduce the uncertainty about whether they work or not. And what I would say to people is, in the absence of evidence, if you think they should be wearing them, go and talk to some children. That's what I've done, and said, what's the reality on the ground? What's it like for you in class? How does it feel? And I can tell you, they hate them. They find it really difficult. They don't adhere to the guidelines. So, for instance, at the end of class, they go in the pocket to pull them out. That's a dangerous issue with co-infections and the potential for that to stay infected for a period of time. So I think, look, it comes back to, at the end of the day, common sense. And in effect, we're going to, in 2 weeks' time, they're being told they can remove them. I think, again, the government should start to look coolly and calmly at the data and then think, where does it have an evidence base and where doesn't it? And that's all I ever do, is say, where's the evidence to inform what we do? And if it's lacking, then you have to sort of on the side of not intervening. Now, one of the key problems we've got when we intervene is it becomes incredibly difficult to roll back interventions. And that's what we're seeing. And that's the great problem now. Just in case approach. That's not how to perform in healthcare.
Professor Carl Heneghan, oh God, I just wish you were the chief medical officer. I really do.